After World War II in 1947, the Kremlin began to think about how to reformat methods of dealing with those who posed a threat to the regime. The mass dispatches to the gulags, which lasted from 1934 to 1953 until Stalin's death, held nearly 1.8 million prisoners. This was too large a number to hide from the international community, making it a rather difficult task.
If you want to move forward with a civilized world, you need to change something, but at the same time, you need to control the population and keep them on a short leash.
And so they learned to isolate people who could not be simply eliminated. With the help of doctors, they were thrown into psychiatry. This began to gain momentum in the USSR, approximately in the mid to late 1960s.
In Europe, one could be hospitalized with diagnoses of schizophrenia, depression or paranoia, but in the Soviet Union, people ended up in such institutions for anything that did not conform to the canons of socialism. Writing poetry, studying foreign languages, wanting to leave the USSR, or God forbid, criticizing the authorities, the term punitive psychiatry is not recognized. There is no such concept.
There is punitive medicine. This term was coined by Alexander Podrebenek, a dissident, journalist, and public figure in Soviet Russia. He himself served a term in such institutions.
So he says that punitive medicine is a tool for combating dissenters who cannot be legally repressed for thinking differently than the rules dictate.
Using such methods of repression or torture is a favorite tactic of socialist regimes. The explanation is this: communist ideology focuses on creating an ideal society where everyone is equal, happy, and satisfied.
If someone is against this, it means only one thing: that person is insane. And the concept of creative punitive psychiatry arose.
It turned out that such methods became an effective way of controlling the masses, even more effective than the gulags.
Now let's talk about how it all functioned.
Punitive psychiatry in the USSR can be conditionally divided into two types. The first is the school of Professor Luntz, which usually diagnosed paranoid syndrome. This is the mildest version of paranoia, and the verdict was delivered by the Serbsky Institute in Moscow. All detainees were brought there for medical examination. I emphasize, absolutely healthy people.
False verdicts and diagnoses vary a way to hold dissenters accountable.
The second type is the school of academician Snezhnevsky, the most popular one. It always delivered the verdict of sluggish schizophrenia, which does not exist in medical practice. It was invented for the KGB. But even Andrei Snezhnevsky believed that schizophrenia was more common than everyone was used to thinking.
It could manifest in mild symptoms, such as a dislike for the USSR, a desire to defend one's opinion, or being too persistent.
After all these legal procedures, the person was sent to a psychiatric hospital. There were many of them, hundreds, but they differed in their methods. Of course, some were worse than others, but this did not change the essence of it.
There were two methods of torture: psychological and physical. Let's start with the first one.
All prisoners were forcibly fed drugs that were contraindicated for healthy people, which broke their consciousness. The conditions in which political prisoners were kept were also not very pleasant.
To put it mildly, they were held in wards with people who really had mental problems. Patients with schizophrenia, child murderers, rapists, serial killers, and so on. This had a psychological effect. Those who managed to survive such imprisonment recalled begging for solitary confinement or punishment cells.
The Kazan Psychiatric Hospital was known for the abuse of its patients. They were chained to their beds and forced to lie in one position for days or even weeks. If they moved, they were injected with ammonazine, sulfazine, haloperidol, or tryptazine. Insulin therapy and electroshock were also practiced. These drugs cause people's spines to contort, bones to break, and reality to distort. It is impossible to induce schizophrenia in a healthy person.
But breaking their consciousness and wiping the smile off their face is a completely achievable task with such drugs.
Just imagine sulfazine is a sulfur solution that burns everything inside. Neuroleptics, intended for mentally ill people, were given to healthy ones, turning them into vegetables. Interestingly, the world was well aware that the Soviet Union was systematically exterminating dissidents and free thinkers. In 1971, at the World Congress of Psychiatrists, Accusations were first made against the USSR. But you understand how it was. Moscow said it was all lies and fabrications. Plus, the Kremlin had many friends in the association from socialist countries, who of course supported the USSR. Thus, proving the existence of punitive psychiatry was impossible.
To help you understand what was happening, think of the UN Security Council when they tried to vote on a resolution about the war in Ukraine, on the recent annexions of territories. Russia votes against it, denies everything, and its partner countries support it, so all the countries know what is happening, but they cannot document it.
This has been Moscow's long-standing practice in all matters. They always do this. And while the world could not solve the issue of imprisoned dissidents in the USSR, punitive psychiatry was reaching its peak, thanks in part to Yuri Andropov, head of the KGB. He proposed increasing the number of beds in such hospitals, and he succeeded. If by 1969 psychiatric torture facilities could accommodate approximately 223,000 people, by 1974, they had expanded to almost 400,000 patients. The 1970s were the peak years for the imprisonment of dissidents, with not only new imprisonments, but also new methods of repression emerging. One of the most unpleasant was the rap.
This involved wrapping a patient in a sheet and then submerging them in a bath. First, the person would suffocate struggling to breathe, and then they were pulled out of the bath. But the sheet was not unwrapped. It continued to shrink on their body, tightening the skin, causing a burning, and pulling cessation, feelings like the skin was being torn off in pieces.
In 1972, Ukrainian mathematician and human rights activist Leonid Plyushch was admitted to such an institution, accused of anti-Soviet agitation with the diagnosis of sluggish schizophrenia. He stayed there until 1976 and experienced many torture methods, from ordinary pills forced down his throat to sulfur treatments. Leonid Plyushch was even fed through his nostrils.
These photos are just to give you an understanding of how it happened.
The patient was put in a straitjacket, with people sitting on their legs and tying their head, body, and legs to prevent movement. A tube thicker than the nostril was inserted, causing bleeding, tears, broken cartilage, and inability to breathe. They poured a nutrient solution through it. So even the process of feeding was turned into a form of torture by the special services and doctors.
But Plyushch was somewhat luckier.
The International Congress of Mathematicians demanded his release, and after thorough processing and much torture, he was discharged from the hospital in 1976. He managed to leave for France with his family, where he lived until 2015.
Let's return to the tortures. Professional dentists often visited these institutions. Patients were tied to beds. Their mouths opened with special tools, and drills were used on their teeth until they reached the jaw, exposing nerves or breaking teeth. After these procedures, the teeth were filed to leave no traces.
Sometimes gaseous oxygen was injected under the skin, either into the leg or the shoulder blades. The sensation was like the skin being torn off, as the gas separated it from the muscle tissue, causing large burns and injuries at the injection site. The pain disappeared 2 to 3 days later, and the procedure was repeated.
You might wonder how doctors agreed to perform such tasks. In reality, it was well throughout. Ordinary doctors administered the medication, often not realizing they were breaking people's psyches. But let's talk about this separately, because
part of the medical staff were KGB agents or criminals. Punitive psychiatry was a place of cooperation between special services and criminals. Criminals were given the dirtiest tasks because they had nothing to lose in prison and eagerly fulfilled all the tasks set before them.
But of course, there were also professional doctors who were generously paid for good work.
In addition to their not small salaries, they were offered various bonuses and a 25% allowance. Some doctors, like Ada Korotenko, a Ukrainian psychiatrist, did not realize their involvement in bloody crimes. It was only in the 1990s that she learned about punitive psychiatry, and the more she dug into the situation, the more she learned about the victims.
There were, of course, many attempts to expose, or at least tell the world the truth. All had partial success.
One such attempt was made in the early 1970s by Ukrainian psychiatrist and human rights activist Semen Glizman To file a lawsuit and show the world the true face of the USSR, he needed a patient.
The subject of his work was imprisoned, General Petro Grigorenko, also a Ukrainian, who heavily criticized Stalin and Khrushchev governments in early 1960s.
Naturally, he was sent for forced treatment and deprived of reality, subjected to torture. Gluzman published an independent examination proving the general's unlawful detention, and under international pressure, he was released and went to New York. But Gluzman himself was unlucky and was taken to a dispensary.
Since 1972, he was imprisoned for 10 years. But in 1977, another attempt was made to discuss punitive psychiatry in the USSR, with psychiatrists from around the world, gathering for a congress in Honolulu.
A special committee was created to investigate cases of psychiatric abuse, and its establishment and work eventually coincided with an interesting period, the early 1980s. The Soviet Union was barely standing, shaken by economic problems and sanctions imposed by the world, including due to repressions.
Nevertheless, punitive psychiatry continued to actively repress people.
In 1980, the USSR hosted the Summer Olympics, and to maintain the ideal image of communism, people were thrown into dispensaries in droves. This continued until 1989, when the U.S. State Department sent a delegation to Moscow to determine the state of affairs in Soviet psychiatry. Do you think most of the patients were actually ill or had congenital mental issues? Of course not. Out of 30 people selected for an independent examination, 14 were completely healthy. From then on, there was even more talk about punitive psychiatry, and something had to be done. This was the time of perestroika.
Starting in 1989, more than 2 million people were released, either from prison or psychiatric hospitals. However, the health problem remained. Leaving such a institution without physical and mental issues was already impossible.
And today, this practice continues in modern Russia. Ilmi Umarov is a living example, and his story is just one of thousands.
Of course, the scale might be smaller, given that it's the 21st century.
It's very hard to hide crimes against people nowadays. Even China, which practically represses the Uyghurs with impunity, cannot hide it completely. So, what can be said about Russia? There are still dispensaries, abuses, and targets include dissidents and people inconvenient for the Kremlin. The main focus of Russian special services and enforcers is on physical abuse. This is a common practice and a well-tested method of operation. Torturing people as a way of re-education has always existed, especially in Russia, especially in the USSR. It's an integral part of authoritarian and totalitarian regimes. Bulgaria, Romania, the USSR, Hungary, Yugoslavia, Albania. Punitive psychiatry was everywhere, just manifesting differently in each country. For example, during World War II, the Germans had the T4 program. This was a method of dealing with political prisoners, dissidents, and genuinely ill people by treating them with euthanasia. But that's another story. Thank you for watching.